Only a laboratory blood test can determine with certainty if diabetes is present or not and make a diagnosis. The following blood tests can be used to diagnose diabetes: fasting blood glucose, glycated hemoglobin, also called A1C, the random blood glucose test at any time of the day, and the oral glucose tolerance test. The oral glucose tolerance test measures glucose 2 hours after drinking a sugary liquid containing 75 grams of glucose. This test is prescribed much less frequently than the other three, since its use is reserved for specific circumstances. The values used by physicians to diagnose prediabetes are taken from the Diabetes Canada 2018 Clinical Practice Guidelines for the Prevention and Management of Diabetes in Canada. The diagnostic criteria are based off of the blood glucose levels associated with the development of microvascular complications, particularly retinopathy. Based on these criteria, prediabetes is diagnosed if one of these tests matches the following reference values. Fasting blood glucose is between 6.1 and 6.9 millimole per liter. This situation is described as impaired fasting glucose. Glycated hemoglobin, or A1C, is between 6.0 and 6.4%. And blood glucose levels 2 hours after drinking a liquid containing 75 grams of glucose range from 7.8 to 11.0 millimole per liter. This situation is referred to as impaired glucose tolerance. A random blood glucose test at any time of the day cannot be used to diagnose prediabetes. A fasting blood glucose test, or glycated hemoglobin, every 3 years is recommended in adults 40 years of age or older, and even sooner and more frequently in individuals with more than one risk of developing diabetes. A prediabetes diagnosis could be considered an opportunity to change certain lifestyle habits to prevent the onset of type 2 diabetes. The faster you act, the greater the long-term health benefits. We suggest taking the test on the Diabetes Quebec website to evaluate your risk of developing type 2 diabetes. The hyperlink to the screening test can be found in the description of this training. Here are the reference values used by physicians to diagnose type 2 diabetes. When fasting blood glucose has reached a level of 7 millimole per liter or more, blood glucose levels 2 hours after ingesting a liquid containing 75 grams of glucose have reached 11.1 millimole per liter or more, glycated hemoglobin, or A1C, results are 6.5% or higher, and blood glucose at any time of the day from the random blood glucose test has reached a level of 11.1 millimole and up. A random blood glucose test at any time of the day can be used to diagnose type 2 diabetes if the classic symptoms of diabetes are also present. In a situation where two test results are contradictory, another blood test will be requested to confirm the test result within the diagnostic range. A confirmation test should be done in all situations where there are no clear signs of hyperglycemia when accompanied by acute metabolic decompensation. If the results of two tests are available and both fall within the diagnostic range, a diabetes diagnosis can be made. In the absence of symptoms of hyperglycemia, if a test result falls within the diagnostic range, a confirmation test will be done on another day. It is best to repeat the same test, except if it is the random blood glucose test that falls within the diagnostic range. In this case, an alternative test, either the fasting blood glucose test, glycated hemoglobin, or oral glucose tolerance test, will be done to confirm the results. In the presence of symptomatic hyperglycemia, a diabetes diagnosis can be made and a confirmation test is not necessary before beginning treatment. A1C is not recommended for the diagnosis of diabetes in children, adolescents, pregnant women, cystic fibrosis, or for type 1 diabetes. These are the values used by physicians to diagnose type 1 diabetes. The procedure and blood glucose values are the same as those used to diagnose type 2 diabetes. In some circumstances, a test to measure the blood marker antibodies of type 1 diabetes may be done to validate the type of diabetes. This course has been made possible with the financial support of Rush Diabetes Care, a division of Hoffmann-La Roche Limited.